Good morning, everybody. Thanks again for joining us on our weekly agent training. Today, I wanted to talk to you guys about some of the mistakes that people make when they're starting their Medicare or shopping for ACA. Okay. But before we start, does anybody have anything that they want to talk about? Anything that they got sitting in the back of their head before I get started? No one? Okay, perfect. So let me pull out some of these things. All right, so
I can talk about the what I made mistake yesterday.
okay, let's talk. Go ahead, Sangeeta.
About one prospect. I had two things. If like I had two things going on right now. So the thing is, the prospect he turned 67 this year. He turned 65 in 1956, and he had work insurance, and he didn't apply for A and B, and he was waiting on that. So the thing is, he called me in October. I said, you have work insurance, and we did little bit comparison, not too much, but he was okay with that, with the work insurance. And in November, he just stopped it. He just stopped it,
Okay.
His work insurance,
Okay.
and didn't apply for the Medicare A and B.
Mhm.
So I had a conversation with him, and I told him, okay, you should have told me like in November when you stopped it. And he didn't felt it very urgent about it. And I thought he has to pay the penalty for that, because it's almost 3 months now. He called me kind of 2 days back. So he will get a penalty on not in the insurance, and he has to enroll within 2 months time. That is 63 days. But I was wrong. It was for Part D, as Carlos told me. But for Part A and B, it's a 8 months period to enroll. So
let me summarize what Sangeeta went through. So Sangeeta had a client who canceled their group policy and contacted her like 3 months later saying, okay, I'm ready to start on Medicare, right? And Sangeeta thought that, well, this guy's in trouble. He had 60 days or 63 days to get his Medicare in place. And now he's in trouble, right? The truth is, when somebody delays their Medicare because they have creditable coverage somewhere else, like through a group insurance, when they finally decide to retire or stop their group policy, they have 8 months. It's not 63 days. They have 8 months to get their A or B in place. This has nothing to do with Medicare Advantage. This has nothing to do with Medicare supplements. This has nothing to do with prescription drug plans. We're just talking about A and B, original Medicare, the red, white, and blue card. So we were scared that he had no chance now, but he really does. He has 8 months to get his A and B in place. Okay, that's one thing. The thing that will be a problem for him, however, is that you usually get 63 days to get a creditable drug coverage in place when you lose creditable coverage somewhere else, right? So the the Part D prescription drug plan might be the issue. We may not be able to get him into a drug plan because he had 63 days to do that. However, he's going to be he's going to probably use an ICEP to get into a drug plan or a Medicare Advantage plan. ICEP means initial coverage enrollment period. That's when somebody delayed their Medicare because they had creditable coverage somewhere else, and now they're finally getting their red, white, their A and B in place. So this guy likely still has a chance, Sangeeta, to get his Part D in place using ICEP. So there's no problem with this guy. However, he will have a late enrollment penalty for Part D because you can't go more than 2 months without prescription drug coverage. And he's gone 3 months already. So if he's able to start his prescription drug plan next month or the month after that, then he's going to have a few months of penalty, but that's not the end of the world. I hope that makes sense to everybody. Anybody have any questions about that? And then what else you want to talk about, Sangeeta?
The other thing about the WellCare website. So
Okay.
it's
So it's very important to understand how to navigate the provider searches for each carrier, because we had a situation where a WellCare plan, they redirected us to a website called HealthNet, or a website for HealthNet. So HealthNet was bought out by WellCare, and we're working with a plan that had just been bought out by WellCare. Anyways, we go to the provider search. On the front page, it asks us to pick the state and the plan that we're working with, right? So we pick the state and the plan that we're working with, and then they ask us to plug in the name of the provider. So we do that. We got the state, we find the exact plan, and we plugged in the name of the provider. And when we clicked search, the provider came up. So we thought we're in the clear. Like, okay, we put the state, the plan, we put the provider, and his name came up when we hit the search. So automatically we assumed that it was okay that he was in the network of the plan. However, if you read a little bit closer, it said search again. Like once you do that step, you need to pick the plan again and see if he's really in the network, right? So we missed that little alert that was there, like in kind of like faded yellow, that said, hey, you need to pick the plan again to see if that doctor that appeared is in the network. When we picked the plan again, he was no longer in the network of that plan. So it's very important to know how to search how to navigate through the provider search through each carrier. Okay. If anybody has any questions about one of the provider searches, or they're having trouble finding a plan, finding a provider in somebody's provider search, let me know and I can help you out. Because at that point, we made a mistake. At that point, the client is upset. We told them that the provider was in network when he really wasn't, and now it's just a little bit of a mess. Not the end of the world, but it's a little bit of a mess. I hope that makes sense. So be careful with WellCare and their provider search, especially when they transfer you over to HealthNet. Okay.
Thank you, Carlos, for yesterday's help.
No worries. Anybody else? Anything they want to talk about before we start getting into these? No? Okay, perfect. Let me pull some of this stuff up. Give me a second.
Wait, Carlos?
Yep.
Okay, so what's in Sangria's situation? Let's say he signed up for A and B while he was at work, quit his job, then then he has B and he does not get a Medicare supplement plan within 63 days, then he would have to go through underwriting.
No, supplements have 6 months from the date of their Part B.
Right. So let's say he had Part B while he was working.
If he had Part B while he was working and he left his group health insurance, then he has 63 days to get it issued, right?
Right.
No medical questions asked, right?
Yep. After that, then it goes to underwriting.
Yeah. Or you can do an open enrollment application and just answer medical questions. But the last resort would be guaranteed issued,
Right. He'd have to go through underwriting though, because he missed his 63 days.
Correct. At that point, yes.
Yep.
Okay. All right. So let's talk about some of these mistakes that people make when they're starting their Medicare. Okay. Number one is not enrolling on time during their initial enrollment period. Very important to help people understand that you have 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. If you miss that window and you don't have creditable coverage somewhere else, then they're going to shut that door on you and they're going to lock it and they're not going to let you get in until the general enrollment period, which happens at the beginning of the year, right? So it's very important for them to understand you have a 7-month window to enroll, to jump into your red, white, and blue card, your A and B. Because if you don't, you may not have coverage, you might have a coverage gap, and you might experience some late enrollment penalties for the rest of your life. Okay? So have a sense of urgency when you're speaking to folks who are turning 65 that don't have creditable coverage somewhere else. Hey, we got the 7-month window, or else we have a late enrollment penalty for the rest of our life. Okay? Number 2, not fully understanding what the different parts of Medicare are. We as insurance agents, we know there are 4 parts to Medicare: A, B, C, and D, and they all do and mean something different. We need to help them understand what A does, which is basically hospital coverage. It's a little bit more complicated than that, but the way I explain it to keep it simple and not confuse people is hospital coverage. If you were formally admitted into the hospital, the bills would be ran through your Medicare part A, right? The way I describe B is I say, B is everything else insurance. The providers have their own bill, the specialist, the doctor that walks into your room, the lab services, the x-rays, everything else has a bill, and that's going to be ran through your Medicare Part B. Let's just call it everything else insurance, right? Then I talk about Part D. Part D is the third piece of the puzzle, which gives you coverage for the medications that you're picking up at a pharmacy. You're going to walk into a pharmacy, you're going to pick up some prescriptions, you have to show your Part D prescription drug card, right? And then Mr. Client, Mr. John, Part C is an alternative to having A, B, and D and a supplement. Part C is everything rolled up into one called Medicare Advantage Plan. And then we start getting into the spiel of private insurance companies, got to follow their rules, use their networks of doctors and hospitals, co-payments, deductibles, out-of-pockets, things like that. But the good thing is all this other stuff that you hear on TV, that stuff is true too. Okay? So mistakes that they try to jump into Medicare, not knowing what all these parts are all about and not talking to one of us professionals, right? Number 3, not considering all available Medicare plans. Oftentimes they come across an agent who specifically works for, let's say, Humana only, and they don't understand that there might be other Medicare Advantage plans out there. So if you're speaking to a client who has already spoken to another agent before, ask them, are they an insurance broker just like us, where we can show you all the Medicare Advantage plans in your area, where we don't have a bias on which one you choose. However, we're going to make a strong recommendation on which one we feel is best for you, because we're the professionals. We understand how this works, and we understand how to shop these Medicare Advantage plans, right? So consider all your Medicare Advantage options, not just the one that the rep from Humana or the rep from United Healthcare showed you. Okay. Questions on this stuff so far? Okay. Number 4, not purchasing additional insurance for gaps in coverage. This is where we come in as insurance brokers. It's going to be somebody like me or somebody like me that's going to sell you the insurance that fills in the gaps. And those gaps are your Medicare supplements, your prescription drug plans, your cancer policies, your hospital indemnity plans, your dental, vision, and hearing plans. If you're not on a Medicare Advantage plan that covers all that stuff, this is where we come in. If all you had was the red, white, and blue card, Mr. John, and the world came crashing down on us, you'd have to pay 20% of everything. And that everything is unlimited. There's no safety net. It can go on forever, right? So this is where we come in. People ask us, how can we cover those gaps? Well, let me show you. Start explaining to them supplements, drug plans, cancer, hospital indemnity, dental vision, hearing plans, all that stuff, or Medicare Advantage plans. Okay. Number 5, assuming original Medicare covers all medical costs. Can somebody tell me 2 things that, let's say 3 things that original Medicare doesn't cover?
Dental, vision, and hearing.
Okay, that's one.
Your physical.
Exactly.
Prescription drug coverage.
Exactly. So it doesn't cover prescriptions, doesn't cover your annual physical, which is one of the aha, I got you moments. People think that now that they have Medicare, they can go get their annual physical every year at no cost. That's not going to happen. Right? So those things, what's a 4th thing? So dental, vision, hearing, all the extra bells and whistles, prescription drug coverage, your annual physical. They do cover a wellness, but they don't cover a physical. What's a 4th thing that they don't cover?
International?
Correct. Yeah, they don't cover international coverage unless it's like the nearest hospital while you're in the United States is one across in somebody else's country, right? But yeah, let's just say it's international.
Experimental for cancer. That's why you should get a cancer policy.
Fantastic. So I keep thinking about more, or we're thinking about more. They don't cover experimental treatments, clinical trials, things like that, right? What else? What's another one? What's one of the biggest expenses that the states have in terms of seniors?
Medicaid. Oh, no, sorry.
Home health care.
There you go.
What'd she say?
Home health care, like long-term care.
Okay.
Long-term care. Yes.
Yeah, long-term care, right? So long-term care, basically, long-term care is not covered by anybody except your own money or an insurance policy you bought a long time ago or Medicaid, the state. But it only gets to the state when you exhausted all your resources. You've exhausted all your savings. You've exhausted all your 401k. You've sold all the extra houses that you have, and now you have no money left. The state is just not going to let you right away. They're gonna pay for the long-term care. Long-term care is I think Medicaid's, if not one of the biggest expense that they have is long-term care. Okay, so this is where we come in. We help you fill in those gaps. You're going to need these things, right? But yeah, this is where we're at. Assuming that original Medicare covers all medical costs, and they don't cover those things that we just talked about, especially long-term care, experimental stuff, preventative. Your annual physical is a big one, you know. Not considering enrolling in a Medicare supplement plan. The only reason why somebody would not consider enrolling into a Medicare supplement plan is because they're not talking to one of us. At least one of our agents, one of my agents, because I'm always trying to teach you guys to give them both options. Our job is to show them what option number 1 is all about. Your red, white, and blue card, a Medicare supplement, and a drug plan, and then a dental, vision, hearing, and a cancer policy. That's like the gold standard. That's option number 1. And then put that to the side. Let's talk about option number 2, Mr. Client, which is a Medicare Advantage plan. So maybe they're only talking to folks who are dealing with Medicare Advantage plans and they're not considering their Medicare supplement. I don't do that. My job is just to educate them on what their 2 primary options are. I'm going to tell them what the good, bad, and ugly is about both options. And they're going to tell me yes or no. They're going to tell me which one they want to go with. I'll make my recommendations. But at the end of the day, here's your 2 options. You're now a Medicare expert. Tell me what you want to do. Right? Number 7, not considering enrolling into a prescription drug plan. Who are the people who come to you and say, I don't want a prescription drug plan?
People who are healthy and they have a supplemental plan.
People who are healthy that are not taking any medications, right?
Right.
They ask you, why do I need to get a drug plan if I'm not taking any medications, Carlos? Well, the truth is you don't have to do anything you don't want to do. That's the bottom line. You don't have to get A, B, C, D, F, and G. You don't have to do any of that stuff. However, the government kind of doesn't make it an option. They say, hey, if you don't get a drug plan, when you're eligible to get a drug plan, that's fine. But later on, when you finally do want to get a drug plan because the warranty is breaking down on you, because the doctor finally said, here, you need to take this $500 medication, and now you want a drug plan? Well, wait. You can't just enroll into a drug plan whenever you feel like it. Now I'm going to make you wait to enroll during the annual enrollment period. So you're going to have a lapse in coverage, right? You're not going to have drug coverage until January 1 of the following year. And on top of that, for being such a jerk and not getting your drug plan when you were supposed to, I'm going to charge you a 1% penalty for every month that you went without it for the rest of your life. So you didn't have it for 5 years, Mr. John? Okay. 12 months in a year, that's 12%. Times 5 years, that's 60% penalty from the national average. And the national average is now like $45. So whatever your drug cost is, whether it's $0, $5, $6, $100, we're going to put 60% from 45 on top of whatever it is that you're paying for the rest of your life. So why don't we just get the cheapest $5 prescription drug plan, have it in place to comply with the requirements, and that's it. If you need it, at least you have it. And if you don't need it, at least you're getting out of that late enrollment penalty. Does that make sense? I hope that makes sense. Okay. All right. So number 8, not being aware of costs, including premiums, deductibles, copayments. Okay. This is where the education comes in. This is where we come in. Understand that everybody has to pay for their red, white, and blue Medicare card, to keep it simple. If you want to get specific, everybody has to pay for their Part B premium. And that premium, as we know it, is $164.90 a month. Some people have to pay more if they did well for themselves, throughout the years, especially 2 years ago. And some people may not have to pay any of that, depending on their income at the moment. If they have limited income, limited resources, we can help people get out of that, right? But be aware that standard, everybody and their mama has to pay that standard premium, $164.90. Okay? Understand that the red, white, and blue card just isn't enough. If all you had was the red, white, and blue card paying $164.90, the world came crashing down, and as you go to the hospital, you got to pay $1,600 right off the rip. $1,600. Here you go. And if you come back, 2-3 months later, another $1,600. 2-3 months later, another $1,600. That stuff resets every 2 months, if I'm not mistaken. Okay. And the deductibles. If all you had was the red, white, and blue card, you have to pay the $226 deductible plus 20% of everything after that. Right? So be aware that the red, white, and blue card just is not enough. This is where we come in, and we have to show you how to protect yourself from these financial exposures. Let's put in these safety nets. Let's get you a supplement and a drug plan and the extra stuff, or let's get you a Medicare Advantage plan and a cancer policy, right? Frank, you got a question?
Yeah, somebody was actually saying veterans. I think that she's assuming that they don't need it. In fact, you and I, we've been talking about it with Tim. I am actually enrolling one guy this afternoon. They can have both. Even if they have TRICARE or VA, they can actually have both. They don't have to. I have one that actually decided just to use the VA. And so I place him in a program where he's actually getting $75 back, from the company. But they can have both. And sometimes this is a good example. One guy in Texas, he says, my DA is about an hour and a half away from me. So he says, it doesn't work for me. Even if I go there, sometimes it's cheaper. Yes. The prescriptions are, they get them for free or whatever. But the inconvenience of having to actually travel a distance. So it was appealing to him to pick up Advantage for him.
Yeah. I mean, if somebody has VA, you're not gonna disrupt their coverage if you put them into a Medicare Advantage plan, right? They're separate from each other. If he wanted to drive an hour every time he wanted to go get his coverage or medications, he can do that, and nobody would care about his Medicare Advantage plan. Now, if he wants something that's more convenient, a Medicare Advantage plan in his area and doctors in his area, then you can get him on a Medicare Advantage plan, no problem. Again, they wouldn't mess with each other. However, somebody on TRICARE, it would mess around a little bit, but if you want to know more about that, we did a training on it. I can send you the video and all that jazz. Okay. Let's see, anybody else in the chat? Tori, who pays first?
Yeah, who pays first? Like if they are a veteran and they get an Advantage plan with a prescription drug plan, does Advantage pay first? Medicare, pardon?
Well, if you have VA and a Medicare Advantage plan?
Yes, correct.
Right? No one pays first and no one pays second. It's either one. It's either one or the other. For example, where are you getting your coverage from? Where are you going to go get service from? Are you going to the VA or are you going to a doctor in your Medicare Advantage plan? If you're going to the VA is going to pay, and that's it. Like,
Carlos?
It wouldn't be. I don't think it would be secondary to. You know what I'm saying? Like if somebody goes to the VA, if I'm not mistaken, the VA pays for everything, don't they?
Right.
Yeah.
Right. I think so. Yes, I think so.
So the Medicare Advantage plan doesn't matter at that point.
So you're saying they don't coordinate benefits?
Correct. They don't coordinate benefits.
Okay.
There's no first or second. It's either you go to VA and VA covers it, or you go to a Medicare Advantage plan and the Medicare Advantage does their thing and you pay your part. But you can't send that part to the VA because you didn't use a VA doctor. Does that make sense?
Yes, that makes sense. Thank you.
Hey, Carlos,
And what does the TRICARE then?
Yeah, this is a good example. 2 days ago, I took my dad, he's 90 plus years old, to the eye doctor. And then we were just sitting there. And then one of the guys who came out, I think he's got an additional test or something, his eyes. And then, so the insurance, his Medicare Advantage, I guess, did not cover that. And she was telling that. And then the daughter of the guy says, well, my dad is, he's got, TRICARE, a VA. He goes, oh, then don't worry about it. He says, that is covered by them.
Yeah. I mean, yeah. Two different things, right? Kathy, you were saying?
The same thing as Frank's saying. I think the TRICARE coordinates, but maybe I don't think the VA does.
Yeah, TRICARE will coordinate with Medicare Advantage for sure, because when you roll somebody in a Medicare Advantage plan and they have TRICARE for life, the Medicare Advantage plan is the primary insurance, and TRICARE for life and ends up working like the supplement. It covers all the cost sharing for the Medicare Advantage plan.
And then is CHAMP for
CHAMP BA is for
Spouses.
Yeah, like relatives or spouses for people who are like disabled, I think, if I'm not mistaken.
Yeah.
Yep.
Yeah. Okay.
Okay. Who knows a lot about Frank? Do you know a lot about CHAMP?
You know what? I've been just recently taken out. Carlos actually had a good video, and then I just recently got another show with Tim, and I'm supposed to meet with him next week because he's gonna have a live in Northbrook. Because I'm dealing with a lot. Well, not a whole lot, but this is gonna be another guy who I'm gonna do in Texas. He's another veteran, and then he's excited about it. But yeah, I can talk to you. Call me after that. I got some notes that I can send to you.
Okay, you can privacy me your phone number, or I'll get it from Carlos. Okay.
So
Cool. Go move.
If you guys want the veterans training, we have it on video, so you guys can rewatch it if you want.
It's a
Yeah,
great
because
video.
I'm running into a couple of CHAMPs.
Okay, no worries. Okay. Okay, number 9. Not understanding the difference between in-network and out-of-network coverage. Real simple. With any insurance policy, whether it's health or auto insurance or home insurance, there's always going to be preferred providers, preferred people that are going to do the work for you, right? And this is what we're going to call in-network. In-network providers give you better pricing, ideally, right? Why do they give you better pricing? Because they've negotiated rates for services with your insurance company, right? So anytime you have an insurance policy, you always want to stay in network because that's where you're going to get the better pricing for your services. Okay. If you go out of network, which means the doctor, the provider, the repair facility, doesn't have a contract with your insurance company, then you're either going to be paying the full amount all by yourself, no help because it's totally and completely out of network, or you're going to be paying more for the services as opposed to if you would have gone in network. So it's very important to talk to about this with your clients, especially if you got a PPO plan, right? Because you have out of network benefits, right? You want to let people know that they can use out of network doctors and whatnot. Give me 1 second. You want to tell people who are on PPO plans that they have out of network benefits. Sometimes you're coming across a plan that their specialist doesn't accept, but they only go see the specialist once a year, right? Everything else is good about the plan other than the specialist being out of network. Well, don't worry. Not the end of the world. You have out of network benefits with this PPO plan, right? So you can still go see your specialist. Just be aware that you're going to be paying out of network prices. Does that make sense? So us understanding the differences between in network and out of network, when it's a good thing, when it's a bad thing, is crucial for us and for our clients' decision-making process. Okay. 10, not understanding the impact of pre-existing
I
conditions.
have a question, Carlos. In
Right.
Medicaid, does they have the in-network and out-of-network things? I just wanted to.
Medicaid?
Yes, Medicaid.
Absolutely. There's in-network and out-of-network doctors on Medicaid.
Okay.
For sure. Yeah, there's a lot of doctors don't want to accept Medicaid because they're not getting reimbursed the amount that they feel like they're worth. For example, like some of the teaching hospitals around us, like maybe a lot of the teaching hospitals, they don't want to accept Medicaid because, man, they're top notch. They do the best work. Medicaid is just not good enough. Who knows? But yes, there's definitely in network doctors that accept Medicaid and doctors that don't, which we're going to consider out of network. Okay. Not understanding the impact of pre-existing conditions. Okay. So we know that Medicare doesn't care about pre-existing conditions, right? The red, white, and blue card doesn't care about pre-existing conditions. We know about how Medicare Advantage plans, they don't care about pre-existing conditions either. The only people that really care about pre-existing conditions are the Medicare supplements, Medigap policies, right? However, even though they don't care about pre-existing conditions for original Medicare and they don't care about pre-existing conditions for Medicare Advantage plans, you still got to consider them because if they got some consistent medical attention that they need, maybe a Medicare Advantage plan may not be the right way to go. Maybe if it's possible to get them on a Medicare supplement or original Medicare with the Medicare supplement, that may be the way to go, right? I hope that makes sense. I hope I'm making sense there. Like, yeah, they don't care, but we need to care about it because one direction might be better for them than the other based on their pre-existing conditions. Does that make sense? And it's
Can you give an example?
Yeah. Let's say they need like cancer treatment, right? If somebody has going through some cancer treatment, we know that on a Medicare Advantage plan, they're going to hit their maximum out of pocket on that plan because they have to pay 20% of chemotherapy or radiation for their cancer, right? However, on a Medicare supplement plan, if we can get them in during their initial enrollment period, during their open enrollment period, then all they're going to have to pay is $226 along with their premium of $120, right? So yes, we have to take into consideration their pre-existing conditions. In the example of having to go through $500,000 worth of cancer treatment, on one option, a Medicare Advantage, it might cost you a few $1,000. On the other side, you know, it may cost you a couple $1,000 as well, based on the $200 deductible and $100 premium. But at least on this side, you don't really have to worry about the bills. You can go where you want, wherever you want, whenever you feel like it, with a Medicare supplement. Does that make sense?
So question, Carlos, if they send a situation like you just described and they've reached their max out of pocket, if they have an Advantage plan, what happens at that point?
Well, then they're fine. It's almost like you have a Medicare supplement because everything else is covered by the Medicare Advantage plan.
Exactly. Okay. I just wanted to be sure of that.
Yeah. The only difference is that they're paying everything until they hit that maximum out of pocket, right? And maybe that maximum out of pocket is super high relative to if they just went on a Medicare supplement, you know? Also, the networks are different, right? A Medicare Advantage plan is going to have networks, and they're going to tell you what you can and cannot do. And a Medicare supplement, you can do whatever you want whenever you feel like it. So again, if I'm somebody with pre-existing conditions and I have to go see a doctor in Texas, but I'm here in Illinois, or I have to see a doctor that's part of this medical group and another doctor that's part of this medical group, and they're not all in the same plan, then yes, I have to consider my pre-existing conditions when I'm making a decision. Do I go supplement or do I go Medicare Advantage? Hopefully that makes sense. Go ahead, Belinda. I'm sorry.
I was going to say, I had a client, with a potential client, and she was having to make a decision like that. She had the opportunity to stay with her job, but it was costing her, it seemed like a lot of money at the time. But when we started comparing, if she went with the Advantage plan, because she was going to the doctors a lot, she had a lot of special, she had a lot of specialists. She had a lot of, costs that she was in it. So when we started looking at what her cost would be if she had an Advantage plan, when you start adding up all of her co-pays and all that, it got to the point where she wasn't really saving money. Going with an Advantage plan, it would have been better for her to stay with her job plan. Yeah, she was paying, a certain amount of money every year, but she had a lot more freedom. And she didn't have to deal with co-pays the way she would have had to deal with the Medicare Advantage plan. So that was an example where we had to kind of like cost it all out to see what was going to be the best for her.
Did you consider a Medicare supplement at that point with her? Did you consider a Medicare supplement with her by chance?
We did. We did consider a Medicare supplement for her.
Because at that, yeah.
Well, the reason we didn't, because with her job plan, she still had all her dental, vision, and hearing. Whereas if she went with a Medicare supplement, you pay the supplement and you get the freedom, but now you got to pick up your own dental, your own vision, your own hearing plans, your own drug plan. Correct. So when you start costing all that out, it just ended up where it wasn't really a big savings for her.
Understood. Yeah. Sometimes it doesn't. Sometimes staying on the group policy is the best way to go. Especially
she had a really good policy.
Yeah, so. that sometimes you can't compete. When you're working with somebody who has a group policy and you're trying to figure out if you should move them into Medicare supplement or Medicare Advantage, one of the biggest things you have to consider is the cost of their medications. Like, are they taking a bunch of crazy expensive medications? Because we know that on the Medicare side, there's no end to the cost. Part Ds do not have an out-of-pocket maximum. That thing can go on forever and ever and ever. However, with group insurance, the cost of the medications are part of the maximum out-of-pocket. So she can have a medication that costs $20,000 a month, and at some point she's going to stop paying for everything, even her medications are going to be covered at 100%. That's one of the main things you want to consider when you're working with somebody who has a group policy is, okay, first, you got any crazy, nasty medications? Because if you do, then we might just be better off staying on the group policy. Because everything, all your medications costs go towards that out-of-pocket number on your group health insurance. I hope that makes sense. Okay. Number 11, not checking for changes in coverage or costs each year. This is silly. However, even though it's so inconvenient to shop everybody's drug policy, everybody's drug coverage every year, it's almost a necessity because we see it time and time again. We're renewing everybody's prescription drug policy, and we notice that the plan that they're on is now in the worst category as opposed to being in the best category last year, So tell your clients, hey, every year we're going to come back here and we're going to review this stuff. And I'm going to tell you, we're going to do the same thing. We're going to plug in your medications. It's going to tell us what's best. And I'm going to tell you we should change, or it's going to come back and say that the same plan that we're on is the best one and we do nothing. Right? On top of that, Medicare Advantage plans change their networks like we change our underwear. Every day there's something different. There's a doctor that says, I'm sick of this. I'm not in your network anymore. Everybody go pound sand. On the contrary, same thing with the insurance companies. Hey, these providers aren't doing their job. They're making us look bad. We don't want them in our network. Or, hey, they're charging too much money now. We can't afford them. We can't have you in our network. Like, checking your coverage every year is almost a must, because we could be talking about thousands of dollars differences next year, the following year. Okay. Go ahead.
The providers are contracted for a year, right? They can't drop out mid-year.
I have no idea if it's for a year or for 10 years. I don't know. I imagine they renegotiate every year, but I'm not 100% sure.
But they can't drop out mid-year, right?
Oh, absolutely, they can drop out mid-year.
Or they can.
Yeah, they can.
So is your advice that the client should check that every time they go to the doctor, if that's a possibility?
I don't think it's that serious, but yeah, there's providers can say, like, I'm just going to stop taking you guys.
Kelly,
they might be contracted to, like, if they saw you already that year, they might be contracted to say, hey, I'm going to continue to see you. But maybe if you're new, they probably have the right to say, here, we're just not taking any more Humana patients or United Healthcare patients. You know what I'm saying?
And Kelly, you'll notice sometimes in commercials or articles, a hospital, their contract might be from September to September. And so a hospital will say, we're not accepting this anymore. A hospital their contract might be a different time period than January to January. Because you see articles like that where they didn't renew their contract.
The biggest headache with Medicare Advantage plans is the network stuff. That's always the biggest headache. So yes, not a bad idea to review your stuff every year. Make sure that your doctors are still in network. And yeah, if you're so worried about your doctor jumping ship, then checking every month to see if the doctor's still in network is you can do that. It's your prerogative if you want to. Although it's a little bit overkill, but yeah, it's possible. Not regularly reviewing bills to avoid overpayment. This is not that bad. I'm going to tell you that from my experience, the bills are processed like properly, the way they're supposed to be processed, but because it happens all the time, like clients will send me like, hey, what's going on here? They send me like, you said it was only $226 in deductible and they're supposed to cover the rest. Why do I got a bill for here, and there? I say, okay, first thing I say, send it to me. Let me take a look at them because I know 100% you're reading something wrong, right? Send them to me. Oh, okay. Now look at this. They did this. This is your amount, $100. The other one did this amount and your amount's $126. Oh, what do you know? $226, right? But again, it's not a bad idea to review it. Some people do make mistakes. Some offices do make mistakes. So yeah, checking your bills to avoid overpayment. Also, especially when you're on Medicaid, you know that you're not supposed to be overbilled, or what do they call it? Excess. What's the term? Whether like the Medicaid will cover the what?
Excess charge?
The
Cost.
balance billing. Yeah. So you can't be balance billed. Medicaid will cover the balance, right? So check that. Okay. Assuming all medical providers accept Medicare. This is, yeah. Not all doctors accept Medicare. We say that 95% of all the doctors in hospitals accept the red, white, and blue card, and that could be accurate, but the 5% don't. You know, some of the top tier specialists just want to accept cash, right? And when we say Medicare, maybe we're talking about Medicare Advantage plans. Yeah, just because your doctor accepts Medicare doesn't mean that they're going to be in the Medicare Advantage plan that we're looking at, right? So we have to search the network. Pretty obvious, right? There, you can go on Medicare.gov and see if your doctor accepts Medicare as payment in full. You can go on the provider on the carrier's websites and see if your doctor accepts the Medicare Advantage plan that we're looking at. Okay. Number 14, not taking advantage of preventative services covered by Medicare. Medicare, red, white, and blue card. We know it doesn't do the physical every year. However, it does do a wellness checkup every year, right? A wellness exam every year. It also does the cancer screening. Some of the cancer screenings are paid for 100%. So if you want to be like the best insurance agent to your clients, find out what those services are and tell them, here, schedule this with your doctor, schedule this with your doctor. Take advantage of these screenings that are covered at 100%, right? On the Medicare Advantage side, they do cover the physical. They do cover a little bit more preventative stuff, usually at 100%. Tell them what those services are and have them schedule their appointments to get some of that stuff done. Take advantage of all that stuff. It's free, covered at 100%. Number 15, not considering enrolling in a Medicare savings program. Oftentimes people don't know that they're eligible for the Medicare savings program. The Medicare savings program is a federal program that helps people with their cost sharing. When I say cost sharing, I mean the deductibles they're responsible for, the co-payments they're responsible for, whatever they're responsible for, that's what we call cost sharing. And the Medicare savings program, if they're eligible for it, could help them with cost sharing. They might cover all of their cost sharing. On top of that, you may be eligible for the other program, low income subsidy, also known as extra help. That helps you with the cost of your premiums, your Part D premiums, and the cost of your medications. So us as insurance agents, we got to understand that these programs are out there. Let's help them get these programs in place, because one, it's just doing the right thing for the client. Number two, it might free up some extra money to get them something else that they're interested in. And number three, if you're doing all this for them, guess what they're going to do? Hey, go see Kathy. This is what she did for me. She's the best. Don't you dare see anybody else. You know what I mean? So ask them, what kind of income do you have every year? Because depending on your income, we may be able to get help to pay for, the co-payments, the deductibles and everything, or we might be able to get help to pay for your prescription drugs and the plans, the Part D premium. Okay. Number 16, not being aware of the enrollment process for Medicare Advantage. There's enrollment periods for Medicare Advantage plans. You can't just jump into a Medicare Advantage plan whenever you feel like it. Why is that? Why can't somebody just jump into a Medicare Advantage plan whenever they feel like it? Can anybody answer that question?
Because with Medicare Advantage plans, you have enrollment points. You know,
why? Why they do that? Why can't I just enroll today if I feel like it?
Well, you can if there's a special enrollment period available to you.
Why do they
But
have
if
all
there's
those
no
special enrollment periods? Why do they have those? Why can't I just say I want Medicare Advantage now and get it without having a special enrollment period, without having whatever? Why can't I just get it now?
There's too many people, 58 million.
Nope.
Imagine everyone. No?
Nope, not the answer I'm looking for.
No, the insurance company enroll and get money from the federal Medicare.
Not the answer I'm looking for. No.
federal guidelines?
Nope. Well, I'll give somebody one more chance. Not the answer I'm looking for.
Make it easy for the Medicare people. Medicare.
Nope. What does Medicare Advantage not care about? Well,
Pre-existing conditions.
There you go, Belinda. Pre-existing conditions. Because Medicare Advantage plans have to cover pre-existing conditions, the only way they can mitigate their risks is having an enrollment period. Otherwise, the only time people would get Medicare Advantage plans when the doctor finally says you have cancer. That's not fair to the insurance companies either, right? I'm not going to get a Medicare Advantage plan because I'm perfectly healthy. I don't need insurance. Next week, I go to the doctor says I got cancer. Oh, okay, now it's time to get a Medicare Advantage plan. It's like crashing my car into a tree today, and then tomorrow calling State Farm and asking them to cover the car crash that I had yesterday, right? That's the reason why everybody has an enrollment period.
It's no different than under 65 or
Exactly.
and for group coverage as well. I mean, you got an enrollment period when you start on board with the group company.
They're trying to limit their risk by covering by having enrollment periods. It's the only way they can limit their risk because they have to cover pre-existing conditions, right? So that's why there's an enrollment period. When people ask you, "Hey, why do I have to enroll in this now?" Well, the law says it, and you want to understand why? Well, this is why, because it has to cover pre-existing conditions, and they don't want you just getting a Medicare Advantage plan when the doctor finally says you're sick.
That's why they have waiting periods for dental.
Exactly. That's why there's waiting periods, for everything.
Yeah.
Yeah.
I mean, Delta Dental, if you had previous coverage, then they'll waive it. But other than that, I'll just wake up and say I have a toothache and
right, exactly.
Throw my $30 down and then drop the plan.
Let's get moving. We're almost done here. 17, not researching all options for assistance with Medicare costs. Okay, that kind of goes along with the other one, Medicare Savings Program. Are you eligible for the Medicare Savings Program? Are you eligible for LIS? Is there any other assistance out there like manufacturers coupons for your prescription drug costs? All those things should be something you should consider. And that's why you should be talking to me, because I do this for a living and I'm aware of this stuff. And I don't blame you. You're not aware of it because this is not what you do 60 hours a week, right? 18, not considering enrolling in a special needs plan. I'm guilty of this. Sometimes I see people that tell me they got metformin and I just keep going with my plan and I don't really consider them being on a, let's say like a chronic special needs plan that is specific to diabetes, right? I'm guilty of this. I need to be more aware of this kind of stuff. But yeah, special needs plans are always available. Dual special need plans. If somebody's on Medicare and Medicaid, consider this stuff. Help people understand that these plans are available to them. Okay. 19, not understanding the impact of Medicare enrollment on Social Security benefits. Okay, so people maybe they don't understand that you have to pay your Part B premium and that's coming straight out of your Social Security check. Okay. Social Security and Medicare, they're cousins. They're not really connected to each other. The only way they're connected is if you're already collecting Social Security and you're turning 65, they're automatically going to enroll you into Medicare. That's kind of the only way they're connected. But you don't have to collect Social Security benefits to be eligible for Medicare. You don't have to be on Medicare to be eligible for Social Security benefits. They're cousins. They're really not connected to each other. The only way is if you're already collecting Social Security, turning 65, then you're automatically going to be enrolled into Medicare. And your Medicare benefit, your Medicare premiums will automatically come out of your Social Security check. That make sense? Am I missing anything there? I think I got that. Okay, number 20. Not being aware of the deadlines for enrolling in Medicare and making changes to coverage. Yeah, so we've talked about this. We talked about these open enrollment period. We've talked about AEP. We talked about IEP. We talked about GEP. We talked about OEP. We talked about ICEP, and we talked about all the special enrollment periods that might be available, right? Everything has its deadline. Everyone gives you a chance to make changes. If you have to make changes, you have to be aware of these things, because if you don't, you might be stuck without coverage. You might have late enrollment penalties for the rest of your life. However, that's not a big deal. The big deal is if the world does come crashing down on you and the bill is $50,000, man, I'm sorry, you forgot to enroll when you were supposed to. Now you're responsible for $50,000. Now you got to dip into the savings, or now you got to let it go to collections, have bad credit for the rest of your life, all that jazz. You need to be aware that there's deadlines to get all this stuff done. Don't be nonchalant about this Medicare stuff, like Sangeeta's client that said, okay, I'm just going to cancel my group health insurance and I'll call Sangeeta whenever I feel like it, right? Can't do that. You have to be aware of these deadlines, or else there will be consequences. Does that make sense? Questions? Did I miss some questions? Anyone have any scripts when calling? I think I have a few. Mike says he has
a question.
Is the savings program for Medicaid, folks? Tori, the Medicare savings program is similar to Medicaid. However, they're two different programs. Sometimes connected, sometimes not. There's Medicare savings program and there's Medicaid. They often do the same thing. They often pay for the cost sharing that somebody's responsible for. However, they're two different programs. And we've done a training on it, and we'll actually watch the video in our new agent training next week on Wednesday. We're going to do that on Wednesday, understanding DSNP and LIS and Medicare savings program. So that one's going to be at 2:00. So if you're interested in that, we're going to watch a video at 2:00 on Wednesday. Okay. Okay, so you'll be
Carlos, on 15th, when you have the new agents training, will there be recording?
No, it will not be recorded. I want people to come in person and interact live, and we're going to do this every month. So if you can't make it this month, we'll do it again next month.
Next month also, I won't be able to attend. But
we'll do it the month after that. No problem.
Okay.
So it's a two-day training, Carlos.
Correct. A 2-day training. If you guys know anybody that wants to, Tori, you can be on Zoom. Not a big deal. If you guys know anybody that is interested, more the merrier. Everybody's welcome. The way it works is the more we give, the more we get in return, right? So if you're trying to help other agents and maybe bring people on board, tell them, here, come hang out with us, see how cool we are. And if you're interested in joining the team, great. If not, man, doesn't matter. Just hang out if you want. Doesn't matter. Okay. So anybody that hasn't registered yet, we're getting pretty full. So I'm probably going to limit it after a little while, because I just don't have the space for it. But you can go to EIT, like Expert Insurance Team, NAT, like New Agent Training, EITNAT.com, and it'll take you to this page. You can watch a little video. You can register. It'll give you the agenda, although we're going to switch this up a little bit, and register, and that's it. Come in and hang out with us.
What's the website again?
EITNAT. So Expert Insurance Team, New Agent Training. So EITNAT.com.
Okay.
Okay, just go there. It'll take you to this form. And if you want to register, great. By the way, Everybody say hello to Olga. Olga is our marketing gal now. She's going to be helping me with a lot of this stuff that I've been doing on my own. So hopefully you'll see more of our presence online everywhere, and maybe you'll see some better marketing material and all that stuff. So I'm excited to have Olga on board. We all should, because anything she does for us is for you guys too, right? What else? Oh, and we're gonna have a professional photographer here. So if you're in Illinois and you want to get a headshot done, go get your hair did, get your hair cut, do whatever you got to do. Come in here and we'll do some headshots for you on me. Okay, it's been something that I always wanted to do. You know, if somebody wants headshots, I'd love to be able to pay for a headshot for you. Shouldn't be that big of a deal. But yeah, that's all I got for today. Does anybody have anything else they want to talk about?
When are you going to have the photographer?
Say that, Frank. Say it again.
When are you going to have the photographer?
Wednesday from 10 to 2.
Next Wednesday.
Next Wednesday during New Agent Training, 10 to 2.
Thanks.
If we are attending on Zoom, do we have to still register for this training?
Yes, please.
Okay, maybe for 2 hours I can attend.
That's fine. That's fine. Anybody else? Anything?
One question, Carlos. Yeah, I run into a lot of people that are illegal. And I know that in Illinois seems to be the only state that has insurance for people that are illegal that are over 65 or under 18. Is there any kind of reimbursement insurance or something that somebody can get if they're illegal or undocumented?
Yeah, so Medicare is obviously out of the question because you need to be a green card holder for at least 5 years or a citizen. ACA is out of the question because you need a social security number. You need to have some sort of like legal status. You don't have to have a social security number. You have to have like legal status. So the only alternatives would be like a short-term medical plan that they don't ask you for your social security number on the application. That's the only thing I can think about, Ted.
They're not cheap.
Other than finding your resources in your community that help folks with that have those kind of statuses. Other than that, a short-term medical plan would be what I would consider, Ted.
Well, how do I get in touch with a short-term medical plan?
Dave has access to short-term medical plans. Let him show you the process, because he might connect you to Thelma, because Thelma is the one really heading a lot of the ACA people and short-term medical people.
Okay, thank you.
Right.
If the people are I-10, can they still get the short-term?
Say that again?
I-10.
With the I-10, yes. Because you don't need the I-10 either. You literally do not need a social security number on the application. Okay.
If somebody's looking for life insurance, I-10 or no I-10, let me know.
Way to plug, Frank.
Thanks for the time.
Okay. So thanks guys for stopping by again. New agent training next week. 2 days, Wednesday, Thursday, come in. If you know some more people that want to join the team, again, I encourage joineit.com and send them our way, and you'll get credit for it. Okay. Everybody have a great day. Have a great
week. Carlos, if I'm not there and if somebody is like wanting to join, can I just give them the number?
Give them the eitnat.com.
Okay.
And have them register. Okay.
Can I talk to you after the meeting?
That's fine.
For you? Okay. Thank you.
All right, guys. Well, have a great day, and I will talk to you guys later. Okay.
All right. Thank you.
Bye, Belinda.
Thank
you.
Bye-bye.
Bye-bye.